Welcome to Asthma Triggers and Environmental Assessments. My name is Katie McMullen and I'm a social worker and certified asthma educator. The objectives for this presentation are to understand the relationship between asthma triggers and asthma flare-ups, to be able to recognize common asthma triggers and how to help families reduce exposure, and finally, how to use the EPA Asthma Home Environmental Checklist and how to utilize it during asthma home visits. Asthma triggers are simply the things that cause asthma to flare up. There are three main categories. The first are respiratory illnesses, the second are allergens, and the third are irritants. There are some important facts that we need to talk about with regards to triggers before going any farther. First, asthma triggers vary from person to person. You may even have siblings or twins that both have asthma, but they have different asthma triggers. That's a key thing to understand. Secondly, it's important to identify what a patient's asthma triggers are, because if we can identify them, we can help that person avoid their triggers and thereby help them control their asthma. Finally, it's key for families or patients and their providers to work together to help identify their asthma triggers. For these triggers, we're going to talk about what common triggers are, and then we're going to talk about things that we can do to control them. So for this first one, respiratory infections is kind of in a category of its own. Respiratory infections or viral illnesses like colds and flus are the most common cause or the most common trigger of asthma in children. When they're having flare-ups or when children with asthma have a cold or a respiratory illness, they often require more quick relief medicine. Often these children stay sick longer than their peers that don't have asthma. And parents of children with asthma need to look for changes in their child's behavior, because especially young children that are too young to verbalize symptoms, because this can indicate that they're starting to struggle to breathe, that they're experiencing asthma symptoms. Suggestions for controlling respiratory infections. Asthma patients need to get an annual flu shot. That's something that for parents that are resistant to that, encourage them to talk with their physician about this. Teaching patients and parents so that they can model behavior to wash their hands correctly and frequently is one of the most important things that we can do to stop the spread of viruses. And then children in this group want to avoid over-the-counter cold medicines. When they are having symptoms of asthma, they need to use their quick relief medicine rather than cold medicines, unless otherwise directed by their provider. So the next thing we're going to look at are common environmental triggers. These fall into two categories: allergic triggers and irritant triggers. Allergic triggers are the things that cause a child's immune system to overreact when he or she comes in contact with these things. These are the things that a doctor can test for. Because the immune system reacts to them, a medical test can be done to diagnose whether or not a child has allergic triggers. Common allergic triggers include dust mites, cockroaches, pests like mice, and pollen and molds. Irritant triggers are the things that irritate or bother all of us, that cause us to sneeze or to cough. But because people with asthma have much more sensitive airways, these irritants bother them much more and can lead to asthma symptoms. There are no tests for irritants other than an individual's response when they're exposed. Common irritant triggers include smoke, extreme temperatures or weather changes, strong odors, strong reactions or emotions, and exercise. In the following slides, we're going to break down these common triggers and look at things, things that we can do to reduce the effects of the exposure to the triggers. The first thing that we're going to look at, the first group that we're going to look at are allergic triggers. Dust mites are tiny insects that are too small to see with the naked eye, and they live in mattresses, bedding, carpet, stuffed animals. They like fabric, and they feed on skin cells. So that's why they're so prone to living in bedding. Suggestions for control include washing bedding in hot water weekly, using dust mite resistant mattress and pillow covers, removing stuffed animals from the bedroom and storing those stuffed animals in plastic containers, removing carpet if possible, but that's a big, that can be a big expense for families. So if that's not possible, dusting furniture and vacuuming floors weekly. Molds are another common allergic trigger. When mold spores are released into the air, they can be inhaled and cause asthma symptoms. Suggestion for control includes fixing plumbing leaks within 24 hours so that the moisture can't build up and encourage mold growth. Cleaning small amounts of mold with bleach and water solution. Avoiding routine humidifier use. Always using an exhaust fan when cooking or showering. And you don't want to allow children to play in leaf piles or other areas with rotting organic material because these are very susceptible to mold growth. Pests are another allergic trigger. These include cockroaches, mice, and rats. Small pieces of the pests and the pest droppings settle into household dust and are picked up by our ventilation systems and end up in the air that we breathe. So suggestions for control include only eating in the kitchen and not leaving out food so that to reduce the presence of pests. Using integrated pest management strategies, and we'll talk about that in a following slide. Fixing leaky pipes to reduce water sources because those water sources draw in pests. And tightly covering food and trash cans to reduce food sources for pests. So as promised, we're going to talk a little bit about integrated pest management strategies. Integrated pest management is just a term for strategies to reduce pests by eliminating access to food, water, and shelter within structures. So integrated pest management strategies include using lined and covered garbage cans, placing outdoor garbage cans away from doors, filling any cracks or holes in the walls, roof, or foundation as soon as possible with metal meshing or other material that pests can't chew through or slip through, repairing leaky pipes and plumbing as soon as possible, storing food in plastic containers or metal containers so that pests can't access it, and only allowing food and drink in designated areas with hard surfaces that are easy to clean immediately. Pets present another allergic trigger. Animal dander from pet urine, skin, and saliva can aggravate asthma symptoms in people who are allergic. Suggestions from control include considering not having pets if allergic, keeping pets out of bedrooms and off of furniture, and washing pets weekly. Pollens, trees, and grasses all present potential for allergens. Pollens are just particles from trees and grasses, flowers that break off and fly through the air. And that we breathe in. Suggestions for control include keeping windows closed and using air conditioners if possible, showering and washing hair and changing clothes immediately after playing outdoors, encouraging children who have like grass allergies and pollen allergies not to roll around in the grass can be helpful. Playing outside before noon because In the morning hours, there's still dew on the grass, and that helps keep the pollen settled towards the ground, so it's lower in the morning hours. Now we're going to move into the irritant triggers. The first one that we're going to talk about is smoke. Smoke irritates the airways and can cause asthma symptoms. Smoke, we think about tobacco smoke, and that's an important one, but smoke comes in other forms as well. So any source of smoke can be a trigger. Suggestions for control include, if at all possible, heating your home with central heat. But this can be hard for some of, especially our rural clients and some of our low-income families. If you heat with a wood-burning stove, make sure that that's properly vented to the outside. When we're talking about cigarette or tobacco smoke, not allowing, making a pledge not to smoke around your children, making a pledge not to smoke in the house or to smoke in the car can significantly reduce a child's smoke exposure. Wearing a smoking jacket or wrap that can keep the smoke off of the parent or smoker's clothes and that can be left outside once they're done smoking can reduce the smoke that's brought back to where the child is. Having the smoker wash their hands and face, brushing their teeth after smoking can also reduce that. And then encourage smokers to utilize the Medicaid smoking cessation tools and the Alabama Tobacco Quit Line tools. Exercise is an asthma trigger. It is a little bit different than all of the other triggers. It is the one trigger that we don't want children with asthma to avoid. With exercise, the name of the game is controlling asthma and controlling asthma symptoms during exercise so that the child with asthma can still fully participate in physical activity. Physical activity is important for children with asthma for all of the same reasons that physical activity is important for all of us. It's important to maintain a healthy body weight and to stay strong. So again, working with a family and working with the child's healthcare provider to come up with strategies to control asthma symptoms during exercise is key. I can't emphasize this enough, and that's why I kind of repeated myself. Suggestions for control, pre-treating or using quick relief medicine before exercise, if exercise is a known trigger, can help. Warming up before exercise and cooling down afterwards so the body has a natural period of adjustment. And then making sure that PE teachers and coaches know what to do if there is an emergency, are all key strategies for control with exercise. Strong odors are something that can trigger asthma flares. Common things in households and school environments with strong odors include cleaning supplies, perfume, hair products, paint, candles, but really anything with a strong or noxious odor can trigger an asthma flare. Suggestions for controlling this, certainly avoid perfumes or heavily scented products in the home environment. Teaching families to only use strong smelling cleaners and paints when the patient's not around and when there's going to be adequate time for ventilation and for the smell to dissipate before the patient returns to the home. And then sometimes, in my experience, this will come up as an issue at school. Sometimes it's about cleaning supplies that the school uses. Sometimes it's about products that either other students or teachers will bring in on their person into the school building. If this is really an issue, then assist the family with initiating a 504 plan that requires the school to make accommodations around these scents. Extreme temperatures and weather changes can trigger asthma flares, as can being too hot or too cold. These are tricky because we can't control the weather, but there are some suggestions to mitigate these. Playing outside early in the morning or late in the day during hot weather can help. Covering the nose and mouth with a shirt or scarf when first going out into cold weather can help, because it just gives the body a chance to adjust to that change from warm air to cold air. And paying attention to changing weather conditions and seasons, helping families kind of track when their child's worst seasons are, and being on the lookout for increasing asthma symptoms during those times so that they can be particularly proactive in seeking treatment. Strong emotions. So strong emotions such as laughing or crying or stress can lead to asthma symptoms. Suggestions for control in these circumstances: encouraging the patient to take slow, deep breaths in and out through their nose can help, and use of quick relief medication if needed. If sometimes I've had parents say that they can't discipline their child because the child's going to throw a fit, and that's going to lead to an asthma flare-up. In extreme circumstances, if necessary, they can pre-treat just like with physical activity. The final thing that we're going to talk about is the EPA Asthma Home Environmental Checklist. You see a picture of the first page of this document at the top of your screen. This environmental checklist is just designed to help asthma home care providers or visitors identify and mitigate common asthma triggers in the home. It's set up to remind us when we go into the home of key environmental asthma triggers to look for in the home visit. It's a very practical tool and easy to follow. It's broken down into 3 sections: building information, home interior, and room interior. The building information is the first section, and it's very short. It just helps you know, like if it's an apartment, a house, kind of a small multifamily dwelling, that kind of thing. And then the home interior and room interior are more specific. And then it provides recommendations for addressing various asthma triggers identified in the residence. And the recommendations that it makes are practical, low-cost recommendations. So my hope is that you will take the information that we've just provided, combined with the recommendations in this checklist, to help families make practical changes based on the triggers that they've identified is affecting their child, to make practical, low-stress, high-impact changes in their home environments. Thank you for joining us for this presentation of asthma triggers and environmental assessments. And please join us for additional asthma trainings in the future. Thank you so much for your time.